To understand the rotator cuff, you first have to understand the shoulder joint. Well, the shoulder joint is a ball and socket joint, and in general, it's a very large ball and a very flat, shallow socket. This allows the shoulder to move in many different directions. However, it does allow instability of the joint by its nature. And there are many structures that help stabilize the joint, but one in particular is called the rotator cuff. And these are a set of muscles and their associated tendons that wrap around the ball of the shoulder, and that allows the head to stay centered on the socket and allow good motion as you're able to elevate your arm. People have issues with the rotator cuff and they come in many forms. Sometimes it's inflammation around the tendons themselves that causes the tendons not to work well and the associated muscles not to work well. Other times we have tears of the tendons and even atrophy of the muscles, or thinning and wasting away of the muscles, which causes the rotator cuff clearly not to work well either. In any case, these things can cause pain, and in some cases actually cause patients to have the loss of the use of their arms completely. Even though you may not have had shoulder pain for a long period of time, oftentimes there's some mild pathology happening in the shoulder, and all it takes is an acute injury to push us over the edge and all of a sudden not have a shoulder that works very well. When we first meet, we'll talk about your shoulder, we'll do an examination, and if you have significant pathology, we may talk about getting an MRI. But in most cases, we actually talk about treating the shoulder as if it's one of the more common issues, which is inflammation or irritation of the rotator cuff. And that's done by treating the inflammation and pain with injections and medicines, and really relying on physical therapy and exercises to try and strengthen the muscles and try and make them work better again. If these things don't work, and we usually try them for about 6 weeks, then we talk about getting an MRI, which is a way that we can look at the rotator cuff muscles themselves. X-rays are also extraordinarily important and help us understand the bones and joints in a way that MRIs don't, but the combination of these two things allows us to understand what might be the right treatment for you. If you do have a torn rotator cuff, in many cases we talk about fixing it. What fixing it involves is an arthroscopic surgery, going into the shoulder with a camera through small poke holes. We're able to go to the rotator cuff, visualize the entire thing, look at the bones of the joint, look at the biceps tendon, another structure that causes pain in the shoulder, and take care of any pathologies that we may see. Once we've done that, we're actually able to take the rotator cuff tissue, pull it back down to the bone, and sew it into place to allow it to heal.
Here's an arthroscopic view of a rotator cuff tear. I'm able to grab the end of the tendon and I'm pulling it back to the bone at the bottom of the screen. For this to heal, we have to be able to compress the tendon down to bone, and we do this using strong sutures which hold the tissue in place while the body can heal this interface.
Rotator cuff tears themselves are not all equal. Some rotator cuff tears involve the entirety of the tendon or are easier to understand. The tendon itself pulls completely away from the bone, and this doesn't allow it to do the job that it needs to do. In this case, we pull that tendon over, reattach it to the bone. Other patients have a partial thickness tear, which could kind of be thought of as a thinning of the tendon, but there are still some fibers intact. It's up to a surgeon to understand exactly how many fibers are there and if they're doing the job they need to do. If not, there are ways to repair this as well, and it often involves taking down the remaining fibers of the tendon or repairing the part that's torn only. We could talk about your specific needs at the time of surgery, and a lot of times it requires us looking at the cuff and understanding how it's torn before we can actually make a plan. And this is done intraoperatively. If we have a patient with a full thickness rotator cuff tear and it's been torn for a long time, eventually the muscle atrophies or becomes weak and thin. And at this point, the tear gets bigger and bigger and bigger, and eventually we'll get to a point where I cannot repair it anymore.
This patient presented with a new injury and new shoulder pain. However, this view shows that this tear had been there for quite some time. The tendon which I'm grabbing is not able to be pulled towards the near side of the screen where I'm looking, the round bone of the humerus. In this case, though the patient's symptoms were new, his tear had been there for many years. We have salvage options to do arthroscopically where we can patch holes like this, but in some cases a replacement's actually a better option.
Every patient's factors really change what surgery is right for them. In some cases, going in and doing an arthroscopic rotator cuff repair is the right answer. And in other patients, perhaps those who are a little bit older or who have more wear and tear of their joint, we may actually talk about doing a type of shoulder replacement called a reverse shoulder replacement, which may be a better fit. But these are things that we'll talk about individually for you. And if you have any questions about it, we can discuss it in clinic.